We're 25% better, which is talking about 65,000 lives saved. So a little difference can make a big difference in a man. Urinary incontinence is almost never seen with our patients. Most men keep their sexual function, and you have a much better chance of being cancer-free. And we would know about the lymph node. The patient would know in advance exactly what he has. He's not going to be asleep on the table when the surgeon is making his own decisions.
Yeah, right.
And then to wake up with no biopsy of the lymph node is something unheard of. But it happened in New York City in the last 6 months. So, gentlemen and loved ones, prostate cancer, please give us a call. Call us at 212-CHOICES during the week. Let's meet. It's better to meet before. There's also data after surgery, but it's better to meet before surgery, know all the data first, and then make your decision.
Yeah, sure.
Then you can't say you didn't know.
Exactly.
Then you know.
Options.
If you want surgery after you know,
right,
and you have a method of treatment that's less good, that's more invasive, that's more damaging to quality of life, meaning urinary life and sexual life, then you know in advance. No regrets. You tried your best, you did your best, and made your decision. But you can only know if you are informed before the treatment. Before the treatment. So we're at the ABC studios. We're at 800-848-9222 if you have questions. I know a lot of you like to listen and not ask questions because you're shy.
But we're here. We're live, so that's why we give the number
we're
out.
live. Our office is just around the corner at 38th and Broadway. So I'm so lucky I can fall out of my office and come right here.
That's right.
For you all, just come over to 38th and Broadway. We're going to hear from our sponsor, the man with the golden voice, the man with the super voice that's got platinum and rubies and diamonds and gemstones and emeralds. Everything's coming out of his voice because he's so fantastic.
And you should see him in person.
He's unbelievable. Now you get to hear him. If you don't think my voice is great, listen to this voice. For cancer treatment, most prefer effective, non-invasive, well-tolerated outpatient therapy. At Radiosurgery New York, the radiosurgery pioneers, that's our goal too. We're first in America, first in New York, first for you with body radiosurgery. We hit your cancer from head to toe with no cutting, no bleeding. We have decades of experience with primary and metastatic, large or small cancers. Cancer treatment with possibly a second chance for you, even if chemo, radiation, or surgery didn't work or isn't tolerated. Our goals are the best results and quality of life. Hi, I'm Dr. Gil Lederman. For a free booklet and DVD, call 212-CHOICES. 212-CHOICES for a fresh second opinion. Most insurances, Medicare, Medicaid accepted. We're super convenient, Broadway and 38th in Manhattan. Hyperthermia 2. To hit your cancer, call 212-CHOICES. 212-CHOICES for Radiosurgery New York. At Radiosurgery New York, the best prostate cancer treatment is custom-tailored for you. Each man with prostate cancer is unique and seeks the best results based upon PSA, Gleason score, and stage. That's why custom-tailored prostate cancer treatment is most logical. Not every man should get the same treatment. Custom prostate cancer treatment here is outpatient and takes as little as 1 hour. Our goals are your best results, avoiding radical surgery, maintaining your sexual and urinary function, and your life. Most insurances, Medicare, Medicaid accepted. Hi, I'm Dr. Gil Lederman. Call us at 212-CHOICES, 212-CHOICES for a fresh second opinion and a free booklet DVD. Conveniently located in Manhattan at 38th and Broadway. For your custom-tailored prostate cancer treatment, call 212-CHOICES. 212-CHOICES. Cherish your life with custom-tailored prostate cancer treatment at Radiosurgery New York.
Welcome back to the Radiosurgery Hour. This is Rob Redstone here with Dr. Gil Lederman at the WABC studios in the heart of New York City. We're just a few steps from the Radiosurgery New York Cancer Treatment Center on Broadway and 38th Street. Dr. Lederman, the leading cancer expert, treats prostate cancer non-invasively. He was the first in New York with fractionated brain radiosurgery, and he's the first in America and in the Western Hemisphere with body radiosurgery. Hey, Dr. Lederman, we're back.
Hey, we're back. I'm back with John.
Hey, Doc.
I'm back with you and all of you. And if you want to call us, you're welcome to do so. I know you're all so shy, so if you have the strength, you can call us at 800-848-9222. 800-848-9222. 9222.
Easy enough.
Yeah.
You can speak to the man with the golden voice.
The man with rubies and
I get to sit next to every week. So.
Emeralds and, rubies are more expensive than diamonds.
Is that right?
Yeah, that's what I read.
Maybe I could honestly say they seem to be more rare, so that would make sense.
Yeah, so next time you meet, Valentine's Day is coming up.
That's right, next Friday.
You may have to think about buying some rubies for her, right?
I'll have to look into that. It's definitely something different. So, yeah.
So we had another patient I saw this week with esophageal cancer. So esophagus is where it's a tube from the mouth to the stomach.
Sure.
And again, it's one of those smoking-related cancers. We've spoken about that. We've spoken about stopping smoking can give you years of life. If you're 30 years old.
Almost immediately, right?
Starting
I've heard
immediately.
Studies, if you stop, and within 5 minutes, things start to change.
That is true. So if you're 30 years old, you get 10 years of life like that.
Wow.
10 years. 40 years old, 9 years of life like that.
Yeah.
And where else can you get such a gift?
Right. I mean, it sure is, and I think...
life is everything.
Yeah, no one's saying stopping smoking is easy, but when you hear stats like that, it's certainly a wake-up.
Have you smoked?
Have I ever? Yes, I sure have.
And have you stopped?
Yes.
How'd you do it?
Willpower.
Yes.
Choosing to just, not wanting to continue that.
So you decided against it and you
stuck with it. That's it. Yep.
So it's all personal decision.
Yeah, sure. Yeah.
No pills, no medicines,
nothing,
no patches.
And it was never to that point, I don't think.
Well, it is. It's very addictive.
Some people have the need for AIDS and whatnot. I say go for it. I think if whatever was going to work, it's worth trying and possibly consulting a doctor if need be.
And how does it feel that you got 10 years of life from just stopping that?
I honestly had no idea until we had this conversation weeks ago, and thinking about that now, I'm glad I decided to not continue that habit.
Incredible gift.
Sure.
Anyway, this man has esophageal cancer, and there's a relationship between smoking and esophageal. He had treatment elsewhere, had chemo, radiation, surgery, didn't work. He came to us with massive metastasis in his abdomen and liver, massive, like the size of a soccer ball. He was in terrible pain. He'd had chemo for a year. It didn't work. He got more chemo. The cancer grew. Chemo grew. Chemo grew. Chemo grew. Chemo grew for a year.
Mm-hmm.
For a year.
Wow.
And he kept on taking it. That's the funny thing. I always tell people, if it's not working, it's just toxicity.
Yeah.
So finally he heard about our program. We were the first in New York and the first in America with body radiosurgery, which means we can hit the cancer. This is not a program of a pharmacy company. This is real people in real practice, and I can give you all the references. Someone called me up at the show last week and said, well, if everything you say is true, it's amazing. Well, come and see. I'll give you the booklet. I'll give you all the references. Everything I say is true. It's based on a reference. I sit in my office all week. I see patients, and I take notes. And every story I tell is a patient that I've seen this week.
Yeah, I know. Yeah.
Yeah. So you have a doubt about it? Come on in. I'll tell you all about it. Most likely the patient will say, okay, I'll tell you my story. So you want the references? We're happy to give you the references. Anyway, after 2 treatments with body radiosurgery, there's 5 planned for this massive cancer the size of a soccer ball.
A soccer ball?
In his abdomen.
Whew.
Okay, massive. His doctors couldn't believe the option was chemo and it wasn't working, so they gave him more. 2 treatments, and the pain is gone. And the mass is shrinking, just with 2 treatments.
No way, wow.
Each treatment's 15 minutes. He walks in, get a treatment, goes home, walks in, 5 treatments, each one's 15 minutes. Yesterday he had his 3rd treatment. I said, how's the pain? He said, it's gone.
Wow.
And examined him. The mass is shrinking. So it's fantastic. So it gives you an idea of the efficacy of the treatment. It's real. It works. We've treated thousands of patients. We have a data bank. We follow our patients, and we follow the effectiveness of treatment for every patient. And you're welcome to come in. As I said, it's best to come in and talk about what the options are. Not everything is for everybody, but most likely there's options available for you or your loved ones. So it's interesting. But another man came in today. This is a man who's 80 years old, and he had lung cancer, and he was on some kind of alternative therapy. Now, the alternative business is really taking a lot of hits because there's multiple new studies showing non-effectiveness. And people are wising up that just because you take mega vitamins and antioxidants, they think that it's going to make them better easy, that there's a magic pill. And actually the studies show just the opposite. And I had one caller who was angry. I took a vitamin and I feel great. Well, it doesn't mean that it hurts everybody. But if you look at studies where you've got death rates of cancer patients that increase if you take mega vitamins or antioxidants, death rates increasing 10, 20, 25%. It tells you that these medicines, so-called medicines, these treatments are not innocuous. So you want the data.
Sure.
So this man was on alternative treatments for a year and a half. He came in to see me just on a fluke. We got some specialized testing. We actually found that his cancer was growing on his so-called alternative treatments. Mm-hmm. There's not really alternative treatments. There's either treatments that work or they don't work.
Yeah.
Right? I mean, it's not alternative. What is alternative? I mean, in the medical world, we use all kinds of things. We use treatments from the bark of trees, from seaweed in the Adriatic Ocean. Things are looked at. Everything that works has a name, and it's approved by FDA, and it works. So it's not alternative. It's either works or doesn't work. Do you want a treatment that works or it doesn't work? Do you want a treatment that's proven to have a chance of treating? There's no guarantees.
Right.
Or do you want a treatment that's never been approved, and it's not been approved most likely for a reason?
Yeah, right.
So this man was on this alternative, and he felt so happy. He was happy. And he came in, and we staged him up, and we found the cancer was growing on the alternative. So he had a spread of his cancer from the lung to what's called a peri-aortic lymph node, a lymph node around the aorta in the abdomen. Mm-hmm. So the aorta is the main blood vessel that comes from the heart.
Sure.
And it feeds all of the body. Every part of the body has blood from the aorta.
Right.
So this lymph node had spread from the aorta, from the area around the aorta. We treated it, and he came back, and it was gone.
Really?
Completely gone. And then he said, wow, you're great. And I said, no, thank you very much. That's generous. Then he went on systemic chemotherapy in the last 3 months, and I saw him this week. I saw him on Monday. And he said, how you doing? I said, you feel pretty good. I said, well, have you proven that everything's good, that everything's working? He said, I don't have to. I'm taking chemo, therefore everything's good. I said, no, that's not how it works. You can take the chemo, and it's fine. If you decide to take the chemo, that's fine. I have no problem with that. But you still, on a regular basis, have to prove, does it work or not?
Yeah, sure.
I mean, you can't just take something on autopilot and then
assume it's going to fix everything.
Assume it's going to fix everything.
Yeah.
And it was back and forth and back and forth. He said, Doc, I'm going to do it. You're right. So it's been 3 months since the last PET scan. The last PET scan showed the radiosurgery worked completely.
Good.
Radiosurgery works where we aim the beam. So the beauty is it doesn't cause hair loss. It doesn't it's lowering a blood count. It works where we aim the beam. So he said, okay. And Monday he said, okay. We got the test on Tuesday. He didn't want it on Monday. I offered it Monday. Got it Tuesday. And he came in. We gave him the disc and the report. Everything was within minutes of him arriving in our office. And it actually showed that the cancer in the area we treated last year was fine. But the cancer being treated by the chemo wasn't fine. It actually was growing back.
Really? Wow.
Grew back in about 3 areas. We talked about other treatment. We talked about radiosurgery. So now he's a big advocate that radiosurgery works, and he wants those areas treated,
because
right?
Because it worked.
Well, number one, it worked. Number two, he has proof that it works.
Sure.
It's not just
in his case alone.
Well, number one, he has the data from thousands. We've treated about 20,000 patients.
Yeah.
So he has the data from that. I mean, that's reassuring for me. How could I sit there and offer treatment and recommend treatment if I didn't have the data?
Sure.
So most doctors don't keep their data. We spend huge amounts of money with data managers and computers and programs to keep the data.
Yeah.
And by doing it means we have the confidence to treat patients. So this gentleman, we treated successfully. He had the chemo, didn't work. He's stopping that chemo because it didn't work, and he should stop. If a treatment doesn't work, stop it. We're treating with body radiosurgery, non-invasive treatment. Comes in 15 minutes, gets the treatment, and goes about his business. So from our point of view,